Good evening. My name is Dr. Brendan Goodger, General Manager of Primary and Community Care at Central and Eastern Sydney PHN. And with me I also have Kylie Somerville, who'll be in the background here assisting me. Firstly, I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community, and pay respects to elders past, present and emerging. I'd also like to extend that respect to any of our colleagues who may be joining us here tonight. Please note that this webinar on the Medicare Urgent Care clinics in Marrickville and Burwood will be recorded and will be available on the CESPHN YouTube channel for the next couple of days. At the end of the webinar, the evaluation survey will pop up on your screens. We appreciate your feedback, so please complete this to allow us to issue certificates of attendance. Now, tonight, please remember to post any questions that you would like. We will not be providing answers tonight. What we will do is collate them and send you out answers within three business days. Now, tonight, I will be briefing you on the proposed Medicare Urgent Care clinics in Marrickville and Burwood. The Australian Government has committed up to $644.3 million to establish a further 50 Medicare Urgent Care clinics over 3 years. That's 2025-26 up to 2027-28 throughout Australia, bringing the total number of Medicare Urgent Care clinics to 137. As part of this budget commitment, Central Eastern Sydney PHN, CESPHN, is funded to commission Medicare Urgent Care clinics in Marrickville and Burwood. Bordering suburbs will also be considered. The aim is to have the new Medicare Urgent Care clinics operational by December 2025. The benefits of the urgent care clinic model: it makes it easier for Australians to see a healthcare professional when they have urgent but not life-threatening need for care, to improve access to urgent care in a non-hospital setting, particularly for vulnerable groups, reduce the pressure on emergency department presentations in partner hospitals by providing patients with short-term episodic care for urgent conditions that are not immediately life-threatening, and to support integration with existing local health services, and importantly, to complement general practice. In terms of the commissioning process, CESPHN is seeking proposals from general practices, community health centres, or Aboriginal community-controlled health services located in Marrickville or Burwood. And as I said earlier, bordering suburbs will be considered. The Medicare Urgent Care clinic must be co-located or partnered alongside general practices that offer full bulk billing where local circumstances allow. Applicants will be required to submit a request for proposal that outlines experience and expertise relevant to the service model, the service value, capacity to deliver the service, and governance frameworks. Submissions will be made using the CESPHN e-procurement portal that is on Tenderlink. So it's www.tenderlink.com/CESPHN/. Okay, so we're using Tenderlink. The request for proposal will be released on Monday, the 18th of August 2025. That's next Monday. The closing date for applications will be Monday, the 8th of September 2025. That's a 3-week period time. The contract we're aiming to be awarded by Wednesday, the 1st of October 2025. Applications will be reviewed by an independent panel that includes representations from primary care providers and the Sydney Local Health District. Both of these proposed urgent care clinics are in the Sydney Local Health District region. All applicants will be notified about the outcome of their application. And as I've stated, it's expected that the UCCs will be operational by December 2025. Note also that we have appointed a probity advisor. So from when this tender goes out, all questions should be put through to the Tenderlink portal, and staff from Central and Eastern Sydney PHN should not be contacted in relation to any further questions. The essential requirements. Very important slide, this one, everyone. The urgent care clinic must adhere to the Medicare Urgent Care Clinic operational guidance. It must adhere to the Medicare Urgent Care Clinic design principles. It must adhere to data reporting requirements and agree to provide all Medicare Urgent Care Clinic services at no charge to patients. And the clinic will also have an escalation pathway agreed in writing with the nearest public emergency department and ambulance providers. Before submitting your proposal, please ensure that you are familiar with the request for proposal process and specific requirements. The Medicare Urgent Care Operational Guidance and Medicare Urgent Care Design Principles will assist you to assess your capacity to operate an urgent care clinic. Strongly advise you to become very familiar with the Medicare Urgent Care Operational Guidance and the Medicare Urgent Care Design Principles. The urgent care clinic criteria, it's based in existing general practices, community health centres or Aboriginal community controlled health services. It must be open 14 hours a day, every day, including Sundays, yes, Christmas as well. Must accept walk-in patients. Must be bulk billed, resulting in no out-of-pocket costs to the patient. Radiology, pathology must be open during the UCC hours and either be on-site or nearby. It also must be able to be flexible and diverse to respond to the needs of the local community. It is, of course, expected that they'll provide high quality, safe and effective care, and to treat conditions that do not require hospital admission, i.e. broken bones, wounds and minor burns. The inclusion criteria, these are some of the things that are part of the inclusion criteria. Lacerations, basic fracture management, suturing and bandaging, minor burns, leg ulcers, pressure injuries, minor dental, that's pain related, ear, nose and throat type issues for foreign bodies, minor head injury without a loss of consciousness, and just a reminder that only urgent care issues will be seen. Non-urgent care presentations are out of scope, and that care is scheduled with the patient's usual GP. In terms of minor illnesses, things like bronchitis, lower respiratory tract infections, ear, nose and throat, gastroenteritis, UTIs, cellulitis, STIs, DVTs, and management of vestibular bleeding, simple catheter or insertional change are some of the things that are also included as part of the inclusion criteria. The exclusion criteria include, but is not limited to, suspected sepsis, infections requiring IV antibiotics, compound fractures, complex fractures, suspected surgical abdomen, suspected anaphylaxis, children respiratory distress, post-surgical complications, and issues in the second or third trimester pregnancy. Again, only urgent care cases will be seen. Now, just a reminder to put your questions in the button below, and that way we've got a record of them and we'll be able to provide a response back to you within 3 business days. So get those questions coming in, peoples, and that way we can get a response if you wish to provide, if you wish to put forward a question. In terms of the referral sources, they include self-referral with booking, without a booking, i.e. walking off the street. Ambulance New South Wales, through emergency departments, through virtual emergency departments such as Virtual Kids, Health Direct, and other telehealth triage services, local general practices and primary care practices, local after-hours services, or other non-GP primary healthcare services such as allied health or community-based nursing services. There is a no wrong door approach that's used. In terms of the urgent care clinic staffing, Medicare urgent care clinics will be GP-led, and the minimum staffing must include GPs with ED experience and or have extended skills in urgent care, a registered nurse or nurse practitioner or paramedic. There must be a receptionist, and the provider must be able to demonstrate they've got access to a pool of on-call GPs or surge capacity. The vocationally registered GP, registered nurse or nurse practitioner, and or paramedic must have further relevant training and skills in urgent care and emergency medicine sufficient to ensure the Medicare urgent care clinics' full scope of services can be delivered safely. In terms of the performance-based funding model, I think it's really important, the slide. There are 5 components to the funding model. There is a base operating grant. So all clinics will receive a base operating grant that's adjusted according to the date of opening. This base operating grant has been calculated to cover non-labour and minimum labour costs. Second component is throughput. Clinics will receive additional funding once they reach a certain number of presentations, reflecting the additional staffing required to manage higher throughput in terms of presentations. Pathology and diagnostic imaging funding will be provided to help meet costs associated with offering pathology and imaging collection services on site. The fourth component is the opening hours loading. A multiplier is to be applied to the base grant funding for clinics that operate with expanded opening hours. Loading is weighted to reflect the higher cost of operating in the less sociable hours period. There's also a regional loading that's based on the modified Monash model classification to reflect the higher costs of operating a clinic in, say, rural or regional locations. In addition to the performance-based funding model, UCCs will receive capital grant funding for establishment costs, specialist equipment funding to support the one-off purchase of high-cost items, or to support the brokering arrangements between Medicare urgent care clinics and private pathology or radiology service providers where required. They will also be able to claim, able to access to claim MBS revenue, including the Medicare bulk billing incentive from 1 November 2025. Urgent care clinics, however, will not be eligible for the Medicare Practice Incentive Program. The below tables are the indicative minimum grant opportunity funding, and this is outlined in the tender that we're putting out on Monday. The amounts for Marrickville and UCC and Burwood UCC are GST inclusive and non-indexed. I won't go through the amounts, but just to note that in total, including base operating grant and capital signage and storage for Marrickville, it's 5.989 million, and for Burwood, it's using the same thing. It's also 5 0.989 million. And the funding goes for 3 years. Okay, to be noted, 25-26 through to 27-28. Data requirements. As you might expect, there are some data requirements. Each Medicare urgent care clinic will be required to enter into a data sharing agreement with the Department of Health, Disability and Ageing, Commonwealth. Medicare urgent care clinics must install and utilise their Medicare urgent care clinic data module with their patient management system. Collection of patient episode information from Medicare urgent care clinics will inform monitoring, reporting, and evaluation. Medicare urgent care clinics will also be required to seek patient consent for the collection and use of the data for each patient episode. Just important to note. In terms of urgent care clinic governance, there is a very robust governance structure in place. There is an advisory committee with CESPHN, the hospital ED representatives, local GPs, and other key stakeholders that, for example, can include a New South Wales ambulance. A local working group, that's the provider, local GPs, again, Ambulance New South Wales, and other hospital ED representatives. There is a federal urgent care clinic operations group and federal community of practice that has representation from a range of federal and key stakeholder groups, including the RICGP. There's also a statewide clinical reference group and a community of practice that's also been set up as well. And then we have the RICGP Urgent Care Clinic Special Interest Group that's been established recently to support GPs in this model. And then CESPHN has its own contract meetings with the provider to deal with those kind of more specific contract type issues to set up the urgent care service. Now, key dates, which I'm sure you'll all be interested in, just to restate them again, right? It's really important, the slide. The tender, an open tender, will be released on Monday, the 18th of August, next Monday. The closing date for applications will be Monday, the 8th of September, 2025. Right? We've given you the weekend. And the contract will be awarded by Wednesday, the 1st of October, 2025. Again, to state that the applications will be reviewed by an independent panel that includes representation from general practice in the local health districts, in this case, Sydney Local Health District. All applicants will be notified about the outcome of their application. It is expected that the UCCs will be operational in December. All right, the sooner we can get them operational is what we're aiming for. Okay. Now, really big top tip, and I cannot stress this enough. Please really familiarise yourself with the urgent care operational guidance and the other Medicare urgent care, and the other Medicare urgent care clinic documentation. It's really important that you spend time really having a close look at those documents and really familiarising yourselves with the tender requirements. We have put together the tender. It should be fairly self-explanatory, but if, however, you have questions, you can submit those questions to us via tender link, and we have committed to provide answers as quickly as we possibly can, and they'll be sent out to all those who register. And of course, if you do have any further questions that's come from tonight's presentation, then put them through to the email address below. The tender is going out on Monday. So if there's any questions, we can deal with that between now and Monday. But after that, then we then enter a competitive procurement process. and therefore we're governed very strongly by a commissioning framework and probity principles. Now, I'm going to stop sharing now, and I'm just going to have a quick. So thank you for the question in the chat. We will take that on notice and provide you with information within 3 business days. All right, which in this case will be by Tuesday, and the tender will be out, but we'll aim to try and get a response back to that question. Now we're coming up to 7:20. I'm happy to call and give you a call tonight to a close. Tonight was a briefing session to all know about our intentions and about the structure of the urgent care clinic, the areas in which it would be operating in, the key governance principles and the clinical principles behind it, and of course the funding and the timeframes for the tender. Thank you all very much for attending tonight, and really do appreciate your interest. Thank you very much.